Why do people snore? Causes, symptoms, affected organs and treatment. Subscribe and comment. There is more behind every disease. While you sleep, your body should be resting. But in many people, the opposite happens. Airflow becomes blocked, tissues vibrate, and snoring appears. During sleep, muscles relax. If the airway narrows or collapses, the airflow becomes turbulent and snoring occurs. In some cases, this obstruction can temporarily stop breathing. This is known as sleep apnea. Snoring is not just an annoying noise, it can be a sign that something is not working properly in your nighttime breathing. Today we will understand why we snore, which organs are affected, and how to solve it. What is snoring and why does it occur? Snoring is a sound that appears when air passes with difficulty through the throat while we sleep. This causes vibration of the soft tissues of the palate, tongue, and pharynx. During sleep, muscles relax. If the airway narrows or collapses, airflow becomes turbulent, and snoring appears. In some cases, this obstruction can temporarily stop breathing. This is known as sleep apnea. Main causes of snoring. The most common are excessive relaxation of throat muscles, overweight or fat accumulation in the neck, large tongue or small jaw, enlarged tonsils or adenoids, nasal obstruction or allergies, alcohol or sedatives before sleep, aging of respiratory tissues. These conditions favor partial blockage of the upper airway during sleep. Symptoms associated with snoring. When snoring is pathological, it may be accompanied by pauses in breathing during the night, waking up with a choking sensation, excessive daytime sleepiness, morning headaches, irritability or depression, lack of concentration, non-restorative sleep. These symptoms are typical of obstructive sleep apnea syndrome. Organs and systems affected by chronic snoring. Occasional snoring is not serious, but when there is apnea or repeated nighttime hypoxia, several systems are affected: brain, lack of oxygen, cognitive decline, memory problems, cardiovascular system, hypertension, heart attack, stroke. Snoring may be associated with serious cardiovascular diseases, respiratory system, chronic airway obstruction, poor nighttime oxygenation, metabolism, insulin resistance, metabolic syndrome. Conventional treatment depends on the cause. CPAP, positive pressure machine, right pointing arrow. Standard treatment for apnea, airway surgery when anatomical causes exist, mandibular devices, treatment of allergies or nasal congestion. Sleep surgery aims to correct anatomical airway obstruction. Natural treatment and lifestyle changes. What really works? Lose weight, sleep on your side, do tongue exercises, bend the tongue upward to the palate and repeat daily, avoid alcohol and sedatives. Tongue and throat exercises, improve sleep hygiene, do not smoke, avoid heavy dinners. Breathing exercises can help widen the upper airway. Conclusion: snoring is not always just a noise. It can be the first warning sign of a serious respiratory problem. If there are breathing pauses or chronic fatigue, do not ignore it. Sleeping well is not a luxury, it is a vital necessity for the brain, the heart, and the entire body.